welcome to Balanced Health. I'm Shirley Rose, and this is Joe Costello. Dentists frequently receive questions about teeth whitening and cosmetic dentistry. Thousands of Americans are self-conscious about their smiles and wonder what, if anything, can or should be done. Today we'll discuss the cosmetic side of dentistry, very important part of dentistry, and we'll look at causes, treatments, and prevention of those unwanted chips and discolorations. To help us understand what options exist, Dr. Ron Shefdore has joined us in the studio. Dr. Shefdore is a dentist, a published author, and has developed a natural system to oral and overall wellness. Welcome, Dr. Shefdore. Nice to have you back.
It's great to be back. Thank you.
And we're going to be talking about something that I think is very important today, and that's a beautiful smile.
In America, it is.
Because I think that one of the first things to age a person are their teeth, really.
Yes, you know, we did a bunch of surveys, and out of 1,000 surveys, do you know that people look at your teeth first, your hair second, and your eyes third?
You're kidding. I would have thought eyes would have been first.
No, not in our surveys. Teeth today are the number one that they'll evaluate you. They'll forget the rest of you. I mean, that comes later on. But yeah, within 5 seconds.
Teeth, eyes, and hair?
Yes.
Good news if you're bald.
He actually said teeth.
You
actually said teeth, hair, and eyes. But
Yeah.
that was a surprise for me.
Yeah. Teeth are number one.
Oh, teeth are number one.
And
You know, I think you know, and I had some work done. I had some. We'll get into that later. But I mean, I can't even express as a person and people I know with the same thing. You would think, okay, you know, whatever. Your teeth are your teeth, and
Right.
it's how much of a difference is it really going to make in your overall being and disposition? And I've got to say, and I usually don't say stuff like this, I was pretty blown away. And I realized I used to look at pictures when I actually became proficient at smiling with my lips over my teeth.
you never smiled, really.
Which looked weirder than my bad teeth.
Let's see you do that. Let's see you smile with. No, you're showing your teeth. Let's see you smile without
my old
showing.
smile.
Yeah. No, you didn't even show him that much.
So I can't even do it
He
anymore.
can't even do it anymore. He's set free. He's set free.
That's good news.
And my husband, same thing. You know, my husband never smiled, and you remember, Dr. Shefdore,
Oh,
he had
yeah.
these spaces, and it was horrible. So I am a big component, you know, of having cosmetic dentistry if you need it.
Well, you know, and that's in the United States. You go to any other country, they know we're Americans right away. I mean, we just smile and we've got white teeth.
Yeah.
That's very unusual for the rest of the world.
Yeah, well, we're going to talk about several procedures, but what are the most common causes of discoloration, ugly teeth?
Well, usually age and food. And those are two things that you just can't get away from. As you get older, the teeth naturally pick up more stain and get darker from the inside. And foods cause it. You know, wine is very popular, vegetables, fruits, we want to eat well.
Coffee.
Coffee, absolutely. You could do that through a straw, though. But vegetables, you know, you've got to eat your vegetables with lots of color in them. They're going to stain.
Well, how often do patients actually come in and say, hey, I want my teeth whitened? Or...
Well, they all want it. They just don't want to pay for it. So everybody wants straight white teeth in the U.S. today. So even if they don't tell me they want it, if I ask them and probe a little bit, well, sure, you know, absolutely. So if I said, if I can whiten your teeth today for free, every patient would say, absolutely, yeah, go ahead.
Well, one rumor I would, or possible rumor I would want to dispel from the top is that this is all about vanity. Because a lot of it has to do with your self-confidence and your self-esteem.
Yes.
And out in the business world, you know, just in the communicative world, you know, those appearances, we can say that it's wrong, that it's that way, but it is what it is, as my father would say. So these things really carry over to, and it's not just a vanity issue. If you feel better about yourself, you've won. We talk about that with Kylea's program with weight loss all the time.
Yep.
Weight loss isn't just about vanity. You know, it's also about your heart, it's about your brain.
That helps.
But when your confidence level, when your confidence level is higher, and when you feel good about how you look, you start becoming better in other things.
Absolutely.
You become funnier.
Well, your potential is realized.
Your potential is realized.
Because you can't be the best you can be if you feel that you don't look good, if you're embarrassed to smile, if you're afraid to smile. I mean, you had a great excuse. You and I have a great excuse, Joe, because we're on TV. But,
Right.
you know, you don't have to be on TV for it to be important. I mean, you're totally right. Would you agree with that? And maybe you can give us some examples.
Well, absolutely. You know, we did a bunch of surveys with business people. And in business meeting, the ones with better smiles and they're taller, it's interesting, those two things were more financially successful today than the ones that were shorter and had bad smiles.
I'll get my teeth done, but I'm not wearing pumps for the taller thing. I mean, I'm gonna have to draw the line there. I mean, it is what it is. Actually, I'm fairly tall for an Italian, but
Yes, you are.
so height and white teeth are leaders.
Yes, and absolutely. And we have story after story in our office where people have doubled and tripled their incomes after they've redone their smiles.
You're kidding.
No, the surveys say that if you have an unattractive smile, that you're not well educated, you're not wealthy, you're not very successful.
Oh my goodness.
Yeah, we shouldn't be like that.
I read something recently where there has never been, or at least since we've had photography and media, there has never been a president with bad teeth, or if there was, so as a public, think about it. You've never seen, a because he's
even George Washington, he had false teeth. They were made of wood, but he did have false teeth.
They look good.
And they look pretty darn good.
and he told the truth about it, that they were made out of wood, because that guy just never lied.
Well, why is it so important? Do you have some, I know you can't mention names, but do you have a quick success story about somebody that's really made a huge difference in their life?
Oh, absolutely. If you see Annie before, she had a big space between her teeth. A lot of people have space problems. And just with a little clear plastic tray that she wore all day long, in 6 months, we closed that space up.
Really?
And we never even drilled in the teeth. We didn't do anything.
Well, let's talk a little bit. We're going to talk about some of the procedures later, but how expensive is it? Has the cost of, say, whitening your teeth, has it come down?
Yeah, whitening the teeth has, and there's many methods that you could do. The problem with is, if you use the inexpensive methods, the sensitivity gets so bad. So the expensive ones that we have today, for example, we put this non-sensitive liquid on the teeth first, and then put the whitening on. So it's a little bit more expensive to do that, but it doesn't cause all that sensitivity.
And that can be terrible.
Oh, that could last, well, as you know, Shirley, it could last for months, sometimes years.
Now, do dental plans cover any part of cosmetic surgery in certain cases?
They don't care if you look good. So, no.
But what if you had crooked teeth that you could actually show was causing things like headaches and other things, or TMJ or whatever?
You have an argument, but keep in mind, dental insurances have $1,000 to $2,000 maximums per year. So it's really not insurance. It's almost like a coupon going to the dentist.
Okay.
But a lot of times the offices have low interest or even zero interest financing programs for some of these products.
Yeah, we've been doing that for 25 years. We have a zero interest for 12 months, and you can go up to 5 years. So, yeah, there's tons of programs. Most of us dentists now do that.
And we always bring analogies up on the show. We're big analogy people of other things people spend money on in their life, And not only so, maybe there's some other things that you could remove from your life and find the budget there. You also have to look at the shelf life of the changes and say, you know what, on an annual basis, this is really not that expensive.
It's not expensive at all, but if you enhance your smile and double your income.
Yeah, there you go. Well, this is one of my favorite topics. We're having a great discussion here, but it's time for a quick break. When we return, we'll talk with Dr. Shefdore about the different cosmetic dentistry options that are available. So don't go anywhere. We'll be right back with more Balanced Health.